everyone, and welcome back to hashtag #CRArthritis with the Arthritis Broadcast Network. We are today, again, third day, in Quebec City at the annual scientific meeting of the Canadian Rheumatology Association and Arthritis Health Profession Association. It's almost finished. No, we have a full afternoon still, and then maybe we will get to the carnival. In the meantime, I'm Isabelle Sritsky. I'm with Arthritis Consumer Experts and the Global RA Network, and I'm super happy to be joined by Alessandra Legge, who's an assistant professor in rheumatology at Dalhousie University in Halifax. She's also a research scientist at ARC and the director of the Dalhousie Lupus Clinic. So lots of hats. And I learned as well that Alessandra is also helping with the planning of that 2023 scientific meeting and has been for 3 years in a row. First year in person after a couple of years. So super busy with that too. So without further ado, I'd like you to introduce yourself and tell us your involvement in rheumatology and how you like it.
Sure. So I'm an adult rheumatologist in Halifax. I have both a clinical practice and I'm also a clinician investigator. I do a lot of research. My areas of interest are in systemic lupus and also looking at the concept of frailty and how that relates to people with rheumatic diseases. As you mentioned, I'm the director of the Lupus Clinic at Dalhousie, so a big part of my clinical practice is taking care of patients with systemic lupus, which I really enjoy. And I guess also good to know I'm relatively new in practice, so after a very lengthy amount of training, I've just been in practice for about 8 months now.
Okay, well, congratulations.
Really,
Thank you. How do you like it?
Oh, I love it.
Yes. Excellent. Great. And so you, I think you presented 2 posters, and
yes.
I think the topics were around frailty. Can you tell us a bit more about this?
Sure. So frailty is a concept that originated in geriatric medicine and in the study of older adults. But I think we're increasingly recognizing how relevant the concept is outside of geriatric medicine and in other specialties, including rheumatology. Essentially, frailty refers to why some individuals are at higher risk for poor health outcomes than others, and really just trying to quantify that risk and to really be able to kind of integrate information from a lot of different health domains to understand what an individual's risk of things like hospitalization or death are. And so some of the work that I've been doing is looking at developing and evaluating tools to measure or identify frailty in patients with rheumatic diseases, and the hope eventually will be to have some interventions to either prevent or treat frailty to improve outcomes in the future.
So one topic of interest of Arthritis Consumer Experts, and we've done a recent study about this is inequalities in healthcare. So I guess the concept of frailty also may be linked to also some social and environmental contexts. Is that something that is part of that research?
Absolutely. So definitely there's a lot of interest right now, both more broadly in the community looking at frailty, but also in my own work looking at frailty and rheumatic diseases, and in looking at how does frailty interact with social vulnerability, and how do those 2 concepts sort of interplay to increase a risk of poor outcomes. Yeah.
Okay, great. And so, as you know, because you're part of the planning Key. So the theme of this year's scientific meeting is Reconnect, Renew, and Reimagine. As a new practitioner, how do you feel about reimagining, renewing the profession, rheumatology? What's in the pipe for rheumatology in terms of treatment, research, technology? Earlier I was mentioning I had an interview with researchers around artificial intelligence, for example. But this is one topic. But how do you see rheumatology? Where do you see rheumatology going?
Well, I think first of all, it's very exciting to be back at the CRA meeting in person, and I think it's just been so reinvigorating and so great just to be able to reconnect with colleagues from across the country, and I think it's been really inspiring, and I think that it will really be a good starting point for a lot of collaborations in research and education moving forward. So that reconnection, I think, is definitely key, and I think that we're definitely seeing that come to life at this meeting, which is great.
Yeah.
I think in terms of reimagining the future in rheumatology, I think in my area of systemic lupus, I think we've seen some really exciting advances recently, both in understanding the pathophysiology of the disease, but also in terms of new treatments that are becoming available to our patients. So I think personally, I'm just very excited about those new possibilities when it comes to treating systemic lupus. And I think, as you mentioned, I think artificial intelligence and specifically machine learning are really going to be playing an increasing role in right now, I think mostly in the research realm, but I think that very soon will be playing a bigger role in clinical care in rheumatology. So I think those are definitely exciting areas to watch.
And as a new rheumatologist, how do you see the patient doctor relationship, and how are you involving patients in their treatment, in the care, in their pathway, to unfortunately not cure yet, but anyway, a better life.
I think that one of the reasons that I love rheumatology and got into rheumatology is because of the ability to form these long-term relationships with patients, and these very strong relationships. And I think that really over the years there's been an increasing focus on shared care and shared decision making, and so I think I do my best to try to bring that to the clinic in terms of when making treatment decisions with patients, and just trying to really make sure that patients have all the information that they need to make informed decisions about their care.
We had the pleasure of having here some patient groups, specifically two for juvenile arthritis, and we see these groups growing across the country, and also trying to give information and support to patients and their families, and indeed sharing tools for shared decision making. So this is great. I think it's very promising, and really at this meeting we see the interaction between patients and also all the disciplines around the patient. So do you work with other healthcare professionals? So it could be occupational therapist, nutritionist, and do you refer patients to that extended team?
Definitely. So I would say most closely I work with a team of nurses and physiotherapists, but absolutely we have access, fortunately, to mental health services for our patients, neuropsychology.
Yeah, I didn't talk about that, but yeah, true, yeah.
Neuropsychology being a big, important resource for us, especially in our patients with systemic lupus who do often tend to have cognitive symptoms as a big part of their illness. And then, of course, lots of interaction with other medical specialties. So especially in our patients with systemic lupus, lots of interaction with our colleagues in specialties like dermatology and nephrology. And then, of course, for our patients planning or going through pregnancy, lots of interaction with our obstetrical medicine colleagues.
That's good. I just had an interview actually with a doctor who has a clinic for women and with rheumatic diseases, and we talked about pregnancy. It's key for planning, in planning, in treatment. So that's great to hear. Wonderful. Any question?
Yeah. So we have one question, and it is: as a relatively new rheumatologist, I assume you're seeing new patients and taking on patients who have rheumatologists that are retiring. Can you comment on this transition and how best to prepare these patients for the change?
For a change when they're changing rheumatologists from one specialist to a new one?
Yes.
Yes, I would say definitely when you're meeting a new specialist, I think it's important to come prepared with your medical history, anything that you think is really important for that new specialist to know. I think that, I definitely do a deep dive into the chart, whatever's available to me, so that I'm as prepared as I can be when I see someone new. But I think don't assume that they have any, don't assume that they already know anything about your previous health history. I think just come prepared and ready to share anything that you think is really critical for them to know.
Yeah. Okay, good. Anything you want to leave with our viewers? Anything you want to say, insights, opinions, I don't know, comforting thoughts?
I guess just, I think this has been a really exciting meeting. I think it's filled me with a lot of optimism for the future of rheumatology as we kind of come out of this crisis phase of the COVID-19 pandemic, that I think there's lots of exciting new ideas and research on the way. So I think just stay tuned.
No, good. Yeah, definitely. And stay tuned here as well for #CRArthritis with AVM. So see you soon. Thank you again.